Hi everybody, Nurse Jordan here. I just wanted to pop on and kind of talk about a few things that I've been thinking about and that have been brought to my attention that might be helpful for you if I kind of review them. So the first thing that I want to talk about is talking to your kids. So yes, this is a stressful time, and these conversations might be hard at times, but make sure that you're available for your kids to talk about it. All the new information coming about COVID-19, it can increase anxiety. I know it has for me. I'm sure it has for most everyone. And anxiety is normal in this kind of situation. It raises our awareness, it makes us more alert, and makes us become more careful. But then, of course, there can be times when anxiety can be overwhelming, and that's when that's all you can think about, or all you're doing is worrying, and you can't enjoy other things in life. So when you're talking to your kids, make sure that you're remaining calm and reassuring. Remember that children will react to both what you say and how you say it, and also what conversations you're having with other people. They're going to be listening to that too. So even if you're positive and reinforcing with them and then have a negative conversation with someone else, they're gonna take that in too. So just make sure you're calm, reassuring, and make yourself available to listen and talk, even if it's just flat out saying, hey, if you want to chat about something, I'm here. That's helpful, just so that they know that. And they probably pick up, we're all stressed, so they're probably picking up on that if you're stressed and feeding off of that. And I know we're all just doing our best, but just try to minimize that around them as much as you can. Allow your children to grieve missed events. So as things are getting canceled or postponed, whether it be graduations, birthday parties, vacations, it's a bummer. It's sad. It's frustrating, and that's okay. Allow them to grieve that, but then also reinforce the positives and try to get them to focus on something else. Avoid language that might blame others and lead to stigma. So remember that COVID-19, the virus, it can make anyone sick regardless of their race or ethnicity, and that's important. Avoid making assumptions that someone may be infected with COVID-19 as well. Pay attention to what your children are consuming as far as television, radio, or online in the news and media, and consider reducing the amount of screen time they have. So yes, we need our screens for education now more than ever, but otherwise, I mean, a little bit of fun stuff on their screens as well, but otherwise try to minimize it, even for yourself. Just put your device in another room, turn the notifications off, take a break. All this information coming in can just be so overwhelming. So just give your mind a little time away from it. And provide information to your kids that are honest and accurate. Be straightforward with them, and give them truthful and age-appropriate and developmental level appropriate information for that child. And also, if you're having trouble with these conversations, reach out to me or even Mrs. Yaidi, our guidance counselor. She would probably be a helpful resource for that as well, and we can kind of talk you through that. And then there are also a lot of great resources on the main CDC website that kind of go through having these conversations with your kids, and there's a bunch of other resources on there as well. So if you haven't been there, I would explore just what they have uploaded for you to use. And in these challenging times, remember to allow yourself to smile. Just allow yourself to enjoy things, even if you're upset about something. Really just take the time to take a break and focus on the positives. Like more family time, the weather's getting warmer, the days are getting longer. We're so lucky to live in an area where we can get out and enjoy the great outdoors, and to really take advantage of that. And remember, this isn't going to last forever. Yes, we don't know how long at this point, but eventually we will go back to some kind of normal. So really focus on that just keep pushing through, and we're going to get to the other side of this. Another suggestion I have is maintaining a routine. So yes, school is different, but we need to try to maintain some kind of routine similar to what we would at school. And this is something that I've been struggling with. The first week or two, I was kind of like, what am I doing? I don't know. Like, how can I still be there for my kids and my students? And now I've created a little bit of a schedule so that we kind of get up, eat breakfast, get dressed, even though that can be hard when you're at home and want to lounge around, but then start into our schoolwork. And luckily my daughter's in pre-K, so that's pretty simple right now, but I know some of you have quite a bit of schoolwork to try to work through. But if you just get up and kind of knock it out first thing in the morning, and then you can just enjoy the rest of your day. So that's a really big part of this, is trying to maintain a routine, because it just, staying with the routine just makes it somewhat easier. Like I said, limiting media, it is important. It's important to get the information and stay up to date, but also be taking breaks from that. Get active, get your kids active. So this is super important, healthy body, healthy mind, but you don't need a gym, you don't need gym class. Like I said, the weather's getting nicer. Get outside, go for a walk, go for a hike. We have all these trails around here in our area that we can use to our advantage to go exploring, have a scavenger hunt, get creative, make an obstacle course, or simply just, like I said, just take a walk, anything. And then there are also some apps and websites that are great for kids for physical activity. I know it's kind of rainy out the last couple days, so you could try Go Noodle is a great website that you've probably heard about, or your kids have told you about because they use it in school too. And then there are a couple other apps and websites as well for some physical activity ideas for kids. Of course, reinforce good hygiene with your family. It's kind of been drilled into our heads at this point. Wash your hands, wash your hands. Make sure that you're doing it for at least 20 seconds. We tell our kiddos, sing the ABCs or happy birthday. Make sure they're using soap and water. Hand sanitizer is great too, but if you have soap and water available, washing your hands is better. And then following respiratory etiquette, so coughing into your elbow, making sure that you're covering your cough, and disinfecting frequently touched surfaces, so countertops, doorknobs, phones even, remotes, anything that you think that your family is touching often, make sure you're disinfecting. And enjoy your friends virtually. I know we can't physically, we can't be with each other, but make sure you're checking in on your friends and family. We are so lucky to have our devices and social media to be able to still connect with the people we love and we care about, including you guys. Like, the fact that I can do this is really great. So try to make sure you're still checking on your friends and family. And then take care of yourself physically. So this is not the time to have a weakened immune system. We want to be on our top notch as far as that goes. So make sure you are eating fruits and vegetables and a well-rounded diet altogether, drinking plenty of water, and getting lots of sleep. Make sure you're getting your sleep. That is so important to avoid illness in general, whether it be COVID-19 or influenza or whatever. Make sure that you're getting your sleep. I know it's easy when we don't have a place to be first thing in the morning. It's easy, oh, I can watch another episode on Netflix. Oh, just one more. And then before you know it, it's midnight, 1 o'clock, or your kids are doing the same thing. You thought they went to bed and they're actually on their devices. If that becomes an issue, consider taking those devices away, because sleep is so important. And then if they're staying up too late, they can't get up in the morning, and then they're missing their Zoom meetings with their teachers and with their classmates. In our school, even though we're not physically in school, we need to be taking this seriously and attending those. Our teachers are working really hard to provide all these materials for our kiddos and to have these meetings. So we really need to make sure that they are following through and that they are attending these and checking in with their teachers regularly. And it's really hard to do that if you aren't getting adequate sleep. So kind of reinforce that with your kids, that they need to be going to bed, just like if they would if we were actually going to school the next day. This kind of brings me into the social distancing aspect, which is another big thing that I'm sure you've seen a lot about or heard about. So social distancing, what it is deliberately creating space, physical space, between people that you come in contact with. And the point of it is to avoid spreading illness. So staying at least 6 feet away from another person does lessen the chances of catching COVID-19. With that, this should be used for only essential outings. So what I'm seeing is a lot of people are, like you've probably seen, there's a couple things going around with people sitting in their trunks 6 feet apart so that they can see each other. I get it. We want to see our friends, we want to see our family, but that defeats the whole purpose of this. The whole point is to stay home unless you absolutely have to get out for food, medical supplies, the pharmacy, the bank. That's absolutely it. Otherwise, we should be staying home. So I know a lot of kids are seeing their friends, they're playing basketball, but hey, we're staying 6 feet apart. I know, I get it, that's what we're hearing, but really we shouldn't even be doing that. And the whole point of doing this is because we want to slow or stop the spread of COVID-19. And so if we're staying in our homes and not coming in contact with people, then we're not having that, what they call as community transmission, because it is so easily spread. And our hope is that we can, I don't know if you've heard this, but flatten the curve. So by doing this, we are preventing everyone getting sick at once and having this high peak of a curve. So if we have everyone getting sick at one time and needing to go to the hospital, and then we are running out of hospital beds, we're running out of medical equipment, or we're running out of doctors and nurses to take care of us because we are overwhelming our healthcare system. So our goal with this social distancing is to kind of flatten that curve, to kind of spread it out so that less people are getting sick at once, and it allows our healthcare systems to really prepare for these COVID-19 patients and to have the supplies to care for them. So we're not, like, when people say, yeah, you really shouldn't be doing that, I'm not trying to be mean. I'm saying it because I care about you guys, I care about my students and our communities, and we really need to do our part and take this seriously going forward. So some examples of this social distancing is working from home instead of your office, closing schools, which we've done, and switching to online classes, visiting loved ones via electronic devices instead of in person, and then canceling and postponing events and travel. So that's really, I think, everything that I wanted to cover. I'm just checking my notes here to make sure. But yeah, okay, so that's pretty much it for today. I also wanted to mention that I am holding weekly open office hours, and they're gonna be done via Zoom. And I know you're probably like, oh, another Zoom meeting, because we're all kind of feeling that. But it's more or less just to know that I'm there for you guys, for parents and students. If you wanna hop on, I'll just be giving little updates, which can be found on the CDC as well. And then I'll be available for questions. So, or if you just wanna chat, if you guys wanna hop on and say hi, that's great too, because I miss seeing all your faces. I'd love to see you and just chat and catch up a little bit. I will be posting those links either here with this video or down below, and you can jump on those as well. So I hope you guys are all doing well. Take care of yourselves. I'm thinking of you and I miss you. Have a good day.